Good morning. My name is Dr. Sanjay Suresh, and I'm a student at University of New England taking Cell Biology course 1050. So today in my video, I'm going to be talking about hemolytic anemia. So coming to the basic definition, what is hemolytic anemia? Hemolytic anemia is a condition where the RBCs get destroyed faster than how much they are produced by the bone marrow. So typically the lifespan of a red blood cell is 120. But in hemolytic anemia, since they are getting destroyed by various causes, the lifespan can get reduced by less than 100. So what are some types of hemolytic anemias? Well, we have the autoantibody type. Autoantibody typically means where the antibodies get attacked and they get destroyed by the RBCs. And there are two types of autoantibody hemolytic anemias. One is warm autoantibody hemolytic anemia, and the other is cold. There are also some different types of hemolytic anemias which could occur through a red blood cell inherited defects. For example, hereditary spherocytosis. This is a condition where there are two proteins present on the cell membrane. They're called ankyrin and spectrin, and they're responsible for keeping the cell in shape. The other type is the enzyme defects. For example, we have something called glucose 6-phosphate deficiency, which is due to a defect in enzyme. So in a couple of minutes, I'm going to talk about each and every one of them in detail. And also the most commonest cause that we see is the sickle cell disease. So coming to the etiological causes, what are some causes that lead to hemolytic anemia? Well, we have some viruses and bacteria. For example, Haemophilus influenza is a bacteria that could cause malaria, HIV, and also we have Rocky Mountain fever, which is caused due to a bacteria called Rickettsia. And also there are various drugs that lead to hemolytic anemia. For example, quinolines, sulfonamide, methyl dopa, etc. And also drugs that are used for malaria, the quinolines. And along with that, the enzyme defects and the inherited defects. So the first type of hemolytic anemia that I would like to talk about is glucose 6-phosphate deficiency. So glucose 6-phosphate is typically typically an enzyme which is responsible. Glucose 6-phosphate dehydrogenase, which is an enzyme. It's responsible for converting NADP to NADPH, and this NADPH is mainly responsible for preventing the damage of the red blood cells by a substance known as free radicals. So it typically prevents free radical injury. So if this glucose 6-phosphate dehydrogenase, if this is defective, then our red blood cells get destroyed by free radicals and it leads to hemolysis. Also, it also acts as a substrate for glutathione reductase, which is also another substance which converts hydrogen peroxide to water, and this mechanism also prevents damage. So these two mechanisms, if they're absent, it leads to hemolysis, and that's why glucose 6-phosphate is very important for our red blood cells. Also, another important type is the sickle cell disease, which is a point mutation, and where there's a protein called beta globulin gene, and there's replacement of a protein called valine to glutamic acid at the 7th amino position. So if this is absent, then it could lead to abnormal formation and sickling of the RBCs, which leads to sickle cell disease. And also another important type is the hereditary spherocytosis, which is due to the defect of the ankyrin and spectrin, which are responsible for mainly keeping the red blood cells in shape. So if this is absent, this leads to deformity and an abnormal structure, and the red blood cells get destroyed. These are the main causes and some of the genes that are involved in the sickle cell anemia. So what are some symptoms that we see in patients who have sickle cell disease? One is fever, jaundice, shortness of breath, abnormal heart sounds. We can have something called hepatomegaly, which is the enlargement of the liver, and also the splenomegaly, which is the enlargement of the spleen. And what do you mean by jaundice? Jaundice is an abnormal discoloration of the skin. We can see jaundice by checking in the sclera. It's yellowish and it's due to elevated bilirubin levels. So these are some of the features that we can see in hemolytic anemias. Now let me come to the inheritance pattern of how hemolytic anemias can occur. The inheritance pattern, the most commonest, is the autosomal dominant cause. Here, we as children, we acquire one copy of the gene from our parents, and then we have a 50% chance of developing the disease. So we can, if we have a copy from our father, then we have a 50% chance we could also be carriers. And also the next important thing is the autosomal recessive. The autosomal recessive means that we inherit the gene from both our parents, and we have a 25% chance of becoming sick and 50% chance that we have that mutation in us, and we carry it down to our next generations. So these are the two important causes. And one more important type of inheritance pattern is X-linked recessive. And this is a very interesting case, because here it is typically seen in males. And what happens is, if you have a father who has an X-linked recessive disorder, then the likely chance is that he is going to pass over all his all the mutations to his daughters. So typically the daughters will be the sufferers, and none of it will be passed down to his son. So daughters will be the sufferer, and the males will be unaffected in this condition. So this is the inheritance pattern of the hemolytic anemias. And what are some diagnostic methods? Well, we could do a physical examination. We could check for jaundice. We could check for abnormal heart sounds. Also by palpatory methods as clinicians and as physicians. We could palpate for an enlarged liver or an enlarged spleen, and we could see the cause for there. And also there are some tests that we could do. We could do something called hepatoglobulin test. And this hepatoglobulin test, this hepatoglobulin protein is an important protein that prevents hemolysis. So if you have decreased amount of hepatoglobulin, then it indicates that the red blood cells are destroyed and it has undergone hemolysis. Also, we have something called Coombs test and the Coombs test. And this Coombs test is the test which detects antibodies that are secreted against the red blood cells that destroy them. So by doing the Coombs test, we can detect whether we have any antibodies. For example, when I talked about warm antibody and cold antibody, this Coombs test is a very important method to detect the antibodies. And also you could do the hemoglobin test. You could check for the normal amount of hemoglobin, and also you could check for the hematocrit. So these are some important diagnostic features that you could check. And now coming to the last part, that is the treatment. The treatment, there's a lot of treatment options. There's some drugs that's erythropoietin stimulating agents. For example, erythropoietin alpha, because typically when you're anemic, you have low amount of erythropoietin. So we need a drug that helps to stimulate the erythropoietin. So that could be there. You could do a bone marrow transplant, and important are blood transfusions. So if you are anemic, then the likelihood is that your hemoglobin count is low, and so you will need to do a blood transfusion for that. And also plasmapheresis. Plasma is a substance that is present in the blood. So if you have less blood, then plasma level is also low. So you want to replace those plasma levels. So plasmapheresis is also another important option that you could give. So these are some main treatments for hemolytic anemias, and they could help. And also some preventive technologies. You could give folic acid, your vitamins, and also you could do a blood transfusion. But typically you have to be careful if you're pregnant. For pregnant women, you have to be careful because there's something called Rh incompatibility. So when a mother is Rh negative and the child is Rh positive, then this Rh factor could lead to complications, and this could lead to further destruction. So you have to be careful in that for the blood transfusion, and give your folic acid, basic dietary measures, folic acid, iron. And so these are some basic treatments and preventable measures. And also some research that is being conducted, that is being conducted right now, is COVID vaccine. It has been shown to cause exacerbation of hemolytic anemias. So that is one research being conducted, and also some drugs on how effective they are on hemolytic anemia. So that's all for my video, and I hope you enjoyed the video, and please do not forget to subscribe to my channel. Thank you.